Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're going to be talking about approaches to the hip, or ways to perform a total hip replacement.
There's a lot of buzz about this.
I'd agree. Particularly because of one approach that has become very popular, not only in the media, but also in surgeons' offices and with patients coming with flyers out of the newspaper.
Right.
So what are the three most common approaches to hip replacement, Paul?
So the most common, a surgical approach means basically how we get to the body part to do the main part of our surgery. So basically the surgical approaches to the hip, so how do we get to the hip joint so we can replace it, are threefold. There's the anterior approach, the posterior approach, and the lateral approach. So front, back, middle.
Right, so the three things that differ are one, where the incision is located, which is probably the least important part of it all. Unfortunately, it's the only part you see, so a lot of patients will fixate a little bit on the incision. But more importantly, what happens below the skin, because that's what's going to result in potentially pain or how long your recovery is going to be, or those kinds of factors. And that's probably why there's still some debate as to what the best way to replace your hip is. At the end of the day, the best approach for you and for your surgeon is the one that's going to most safely get a hip replacement into your hip in the best position with the least amount of complications.
Okay, so why don't we start with the anterior approach, since that's the one that it seems to be receiving the most media attention. The anterior approach to the hip, what is it?
Okay, so the anterior approach to the hip is by far the most talked about one right now. It is not a new approach to the hip. The way it's discussed, you'd think it was discovered last week. But it's not. It's been around for a long period of time. It just has not been the most common way to replace someone's hip. But what it is after you've made a slightly anterior incision over your hip, you go through two different planes, or what are a space between two different muscles. So superficially, you're going between a muscle called sartorius and tensor fasciae lata, superficially, and then the deep interval is between gluteus medius, or the muscles called your abductors, that we're going to talk a little bit about later in the lateral approach, between gluteus medius and rectus femoris, which is one of your thigh muscles. And what happens in the anterior approach that's different from some of the other approaches is you're going between the muscles. You are not splitting the muscles, you are not cutting them, you're going between them. And the big advocates of this approach say that it's going to cause less pain, less damage, and get you up and get you going sooner. Is this true, Paul?
No. So, I mean, I think, I don't do the anterior approach. However, advocates of the anterior approach say that because you haven't peeled any muscle off bone, people get up quicker. It's possible that they might get their strength back a little bit quicker.
Yep.
Some of the evidence is showing that, but the outcomes after about, I think it's like 6 months or so, the outcomes are all about the same anyways. I think one of the drives is to get people out of hospital faster, and I don't think that has to do with where you make your skin incision or what muscle planes you go through, more so than the infrastructure in your hospital and the home care you receive when you go home is what dictates how quick you get home.
For sure.
So, but the advocates of the anterior approach say, yeah, we get people up moving quicker.
Yeah, and I would agree with you, and that's the big push, is that people can get home sooner, potentially the same day or next day after surgery. And that may be true. What I tell my patients when they ask me about the anterior approach, because I would agree I'm not a typical anterior approach surgeon, I tell them that my goal is that you have a good hip for the rest of your life, not on day number 1 or day number 2. And there's lots of ways that we can debate that back and forth. Certainly there are some risks and complications specific to the anterior approach that we're not specifically going to discuss, but it's not without a steep learning curve that takes a long time.
Yeah, I would say it's safe to say the complication rate of an anterior approach to the hip is higher initially than the other approaches, and then the risk of neurologic injury. There's a superficial nerve that gives you sensation in the front of your thigh that is more commonly than not injured with the anterior approach.
Because of the amount of traction you have to put on the muscles, because you're not splitting.
Yeah, so some numbness in the front of your thigh is common. Whether that's a big deal to you or not is debatable.
Sure.
Okay, so that's the anterior approach.
Posterior approach.
Posterior approach, so anterior means front, posterior means back. The posterior approach, again, not a new approach. It's been done for a long time. It's where you go split the muscles of gluteus maximus, which is a big muscle along your buttock. You split that and go down and remove some muscles called the short external rotators off a portion of the top of the femur that makes up part of the hip joint, and that's how you get access to the hip joint from the back.
Okay.
This was a popular approach. However, the dislocation rate associated with this approach used to be very high. It's not as high now because the implants that we use are different in that the heads that we use in our artificial hips are bigger, so the risk of dislocation is decreased. So the risk of dislocation associated with the posterior approach has gone down, and there are some people who are strong advocates of the posterior approach.
Yep. Especially with modularity too, longer necks, more head choices.
Sure.
Yeah, lots of choices when it comes to implants now that can help reduce the risk of a dislocation.
Right. I'm not a posterior approach surgeon, but the advocates would say that you don't damage the muscles that are responsible for abducting or making your leg go outwards, and maybe have less chance of a limp after.
Absolutely. That brings us to the third approach, or the most probably common approach in North America, for sure 5 years ago anyway, would have been the lateral approach.
Right.
So what the lateral approach is, it's an incision that's kind of between the two. So if you had the anterior approach in the front, the posterior approach in the back, actually I have a handy model here.
Well, there you go.
The lateral approach is directly along the side. So this is a model of a right hip. So this is the upper part of your waist called your iliac crest. This bump here is called your greater trochanter. It's the bump along the side of your hip, and deep inside of here is your hip joint. So when someone has a lateral approach, they're actually on their side, and the incision goes right along that bump. So what happens is, as you make the incision through the skin, we split what's called the fascia. You come down on what's called gluteus medius, or this is one of the three muscles called your abductors. And this is the muscle that we release. And what happens is we split it, and then we release the tendon right off of the bone. And this is the concern for anterior approach surgeons, that when you're releasing a tendon off of a bone, there's possibility that it doesn't heal properly at the end of the operation. But what we do is we sew it back to the remaining intact tendon, sometimes even through little tunnels in the bone. And by releasing that and repairing it, that's going to reduce your risk of a limp, which probably is the number one complaint or issue that people that are against the lateral approach would say. They're worried about a prolonged limp.
Right. Okay, so the thing to remember is, the bottom line is, there's three main approaches to get a total hip implanted. They all have risks and they all have benefits. So your surgeon will pick the one that he or she feels most comfortable with to get the job done. The good news is all three of them are excellent at getting a hip replacement done, and the hip replacement procedure is an excellent procedure. I say total knee replacement is a good procedure, not a great procedure, but I say a hip replacement is a great procedure in that the chances that if you have a hip replacement, you will have near complete pain relief and be happy with the outcome is very, very high, like in the high 90%.
I would agree with that.
And when I'm teaching residents, I'll say, it's very unlikely to go through a clinic and not see someone who's not happy with their knee, but it's very unlikely to go through a clinic and see someone who's not happy with their total hip replacement.
Yep, I would agree. So that's just our summary on the three approaches to hip. Remember that the approach itself is probably not critical. Ultimately, what you want to ensure is that the position of the implants are in the proper position, and that it gives you a high chance of that implant lasting for the rest of your life. Where the skin is and which muscles are split is certainly less important. It is an issue, but it's less important, and you want your surgeon doing their approach that they're the most comfortable with.
Yeah, and a lot of surgeons will quote evidence in the literature. It's very, very difficult to show one approach is better than the other approach on the long term, because the long-term outcome of a total hip replacement is very high. Like, there's about a 98% 10-year satisfaction with all the approaches. So if you want to show one approach is better than the other, you will have to follow these patients out for 20 years, and you'll have to have thousands of patients to show that incremental improvement in outcome over a long period of time, and nobody is going to carry out that study to prove that. So really be careful when you're out there trying to decide what approach you want. In my opinion, it's probably best to just let your surgeon decide what approach they feel most comfortable with, and recognize the fact that if you have your hip replaced, there's a very good chance you're going to have a very good outcome.
Well put. If you like this video, please like it on YouTube or subscribe to our channel.
And remember, you are in charge of your own health, but not the approach to your hip.
See you next time.